Top stories. Walk-in allowed for seafarers, OFWs, PWDs at NOAA. Seafarers, overseas Filipino workers or OFWs, and persons with disabilities or PWDs may walk to the vaccination site in the new normal Oasis for Adaptation in a Home or NOAA complex in South Road Properties or SRP Friday, August 13, 2021. The Office of the Cebu City Vice Mayor in a Facebook post said seafarers, OFWs, and PWDs may walk in at NOAA complex provided they have registered in the city's vaccination program pabacunata.com. Seafarers and OFWs may bring their job contracts, passports, and plane tickets as proof that they are seafarers and OFWs. The Vice Mayor's office also reiterated that senior citizens may walk in at NOAA Complex, Robinson's Galleria, Ayala Center, Cebu, and SMC Seaside City. Travel restrictions on 10 countries extended. President Rodrigo Duterte has approved the recommendation to extend the restrictions on travelers from India, Pakistan, Bangladesh, Sri Lanka, Nepal, United Arab Emirates, Oman, Thailand, Malaysia, and Indonesia to August 31, 2021 as a measure to prevent the entry of more Delta and other SARS-CoV-2 variant cases. The Interagency Task Force or IATF for the management of emerging infectious diseases has also allowed persons over the age of 65 to go out of their residences to personally file their certificates of candidacy in the national office and designated field offices of the Commission on Elections. They shall be recognized as authorized persons outside of residence from October 1 to 8, 2021, regardless of community quarantine classification and vaccination status. Also approved is the request of airlines to resume international transit hub operations. This international transit hub operation shall be limited to airside transfers between Terminals 1 and 2 and within Terminal 3 of the Ninoy Aquino International Airport and further limited for countries, jurisdictions, territories in the Green List. As such, protocols for the controlled movement of passengers and health and safety protocols within the terminal shall be strictly observed. Any traveler who may exhibit symptoms shall comply with isolation and quarantine protocols which shall be for the account of the sponsoring airlines. Malacanang said the IATF directed the Department of Foreign Affairs, Bureau of Quarantine and Bureau of Immigration to formulate the necessary protocols for the issuance of appropriate visas applicable on a case-to-case basis. Additional AstraZeneca vaccines arrive for private sector. Another batch of AstraZeneca vaccines procured by the private sector arrived in the Philippines on Friday, August 13, 2021. The National Task Force or NTF against COVID-19 said 575,800 doses of the AstraZeneca vaccine against coronavirus disease 2019 arrived at 9:35 a.m. at the Ninoy Aquino International Airport. Presidential Advisor on Entrepreneurship Joey Concepcion said the arrival of these vaccines is very timely as we are aggressively rolling out vaccination efforts to help prevent the transmission of the Delta variant. These doses of AstraZeneca vaccines will complement the government's effort to mitigate the spread of the Delta variant. Ramped up vaccination during the ECQ will help us beat the Delta variant, thereby allowing us to save the fourth quarter of the year from irreversible effects to the healthcare system of the economy. The vaccines were procured through the ADOS of Hope program of the private sector. The arrival of these vaccines brought the total deliveries to the Philippines to 42,091,150. NTF Chief Implementer Carlito Galvez Jr. said 26,677,269 doses have been administered nationwide as of August 12. A total of 12,182,006 individuals have been fully vaccinated. The government recorded the highest number of administered shots in one day at 710,400 482 on August 5. For Davao areas under GCQ with heightened restrictions until August 31. The entire Davao region will still remain under General Community Quarantine or GCQ with 4 areas placed under heightened restrictions or HR until the end of August this year. This was announced by Presidential Spokesman Harry Roque on Friday, August 13 in a statement. The Interagency Task Force for the Management of Emerging Infectious Diseases or IATF-EID, with approval of President Rodrigo Duterte, approved the extension of the GCQ with heightened restrictions in Davao City, Davao del Norte, Davao de Oro, and Davao Occidental until August 31. Davao Oriental and Davao del Sur remain under GCQ with no restrictions until the end of the month. Previously, the entire region was placed under Modified Enhanced Community Quarantine or MECQ on July 1 to 15 due to the rising COVID-19 cases. Based on the Department of Health Davao Region data as of August 12, the entire region has a total of 58,511 confirmed COVID-19 cases. Out of the total cases, 7,013 are active cases, 49,556 are recoveries, and 1,942 are deaths.
Today in Baguio City Center.
Yes, tonight
90% of VSMMC's COVID deaths in August were unvaccinated. Majority or 90% of COVID-19 mortalities recorded in Vicente Soto Memorial Medical Center or VSMMC during the first 8 days of August 2021 were unvaccinated individuals. Dr. Helen Madamba, Chief of the VSMMC's Professional and Allied Health Services, Medical Social Service, and Health Information Management, said from August 1 to 8, 2021, they had 47 COVID-19 mortalities and 90% of them, or about 42 individuals, have not been vaccinated against COVID-19. VSMMC is a Department of Health retained hospital. As of August 13, the number of confirmed COVID-19 cases at VSMMC was at 3,366, while the number of confirmed COVID-19 cases that were admitted to the hospital was 189. The hospital has logged a total of 1,371 COVID-19 recoveries and 781 patients transferred to isolation centers. The VSMMC also logged a total of 832 deaths since the start of the pandemic. These mortalities are from different geographic origins. As of August 13, a total of 90 out of 99 dedicated COVID-19 intensive care unit beds in VSMMC are already occupied for a utilization rate of 91%, while 174 out of its 197 expanded COVID-19 beds are also currently in use. Moreover, Dr. Reynet Christine Ligaray, Chief of the Medical Service Division of the VSMMC, said due to the need to expand COVID-19 wards in the hospital, the VSMMC is intending to temporarily use the new Center for Behavioral Sciences or CBS building to admit non-COVID patients from internal medicine and orthopedic patients. The CBS is projected to accommodate a total of 80 beds. She said the new CBS building is intended for patients who are potentially violent or may be agitated, but currently it is used as a vaccination center for VSMMC employees and other government employees. She said this is also to separate non-COVID patients from COVID patients being taken care of at the main hospital. Cebu COVID cases in 7.5 months more than double 2020 cases. In the first 7.5 months of 2021, Cebu has already recorded more than double the 23,172 COVID-19 cases it recorded in the whole of 2020. Data from the August 13, 2021 Bulletin of the Department of Health 7 show that the entire Cebu has recorded 54,929 COVID-19 cases so far this year, 137% more than the cases recorded in 2020. The first COVID-19 case in Cebu was reported on March 18, 2020 in Mandawi City. Cebu City accounted for the bulk of the 54,929 cases reported this year at 41% of cases or 22,569 cases. followed by Cebu Province, 18,184 cases or 33% rather. Lapu-Lapu City, 7,515 cases or 14%, and Mandawi City, 6,661 cases or 12%. With its 3,913 active cases on August 13, Cebu City also eclipsed its all-time high 3,852 active cases recorded on July 7, 2020 as it now battles a third wave of COVID-19 cases that has overwhelmed its hospitals. Cebu Province, which comprises 44 towns and 6 component cities, makes up 64% of Cebu Island's population. Cebu City makes up 19%, Lapu-Lapu City is 10%, and Mandawi is 7%. In terms of numbers of deaths in the entire Cebu, the 1,291 deaths so far this year are approaching the whole year 2020 total of 1,384 deaths. More than half of the deaths this year, or 56%, were recorded in Cebu Province, 730 deaths, followed by Cebu City with 335 deaths or 26%, Lapu-Lapu City with 124 deaths or 10%, and Mandawi City with 102 deaths or 8%. The first wave of COVID-19 cases in Cebu was reported in May 2020. The second wave occurred in the early months of this year following the Christmas and New Year holidays. The first arrival of COVID-19 variants and the general complacency of residents in following health protocol after cases drop at year-end. That's all for the news and information that empowers Philippine communities from Sunstar. This is Joshua Carlos for One-on-One News.